Hello, John. Welcome to Secure Insights. We're glad to have you here. How are you doing? How are things going on with you?
Oh, thank you very much. I'm delighted to be here. Things are going very well. So I look forward to our conversation.
Great. So today we are here to discuss about the rise of data breaches in healthcare industry, right? And how you can reduce the risk related to that. So my first question around the same topic is for you. What is your take on the recent data breaches that have been affecting the healthcare industry, and what are your thoughts on that?
So we've seen a continuing uptick in data breaches in general, but I'm particularly concerned with breaches in the healthcare field because the kind of different consequences for a healthcare data breach can be so much more significant than just the financial consequences of a data breach in another area. So we continue to see that hospitals and other healthcare providers are being targeted both in the US and across the globe. And the ability to misuse that data is greater than almost every other kind of data.
Looking at that, there is a lot of data and personal identifiable information that can be exposed through these data breaches. So, can you tell us about what are these factors that drive the heightened concern for cybersecurity in the healthcare industry?
Sure. We start with the basic concern that people are more concerned about the privacy of their healthcare information than almost any other kind of information, right? Under the GDPR, it gets heightened protection. In the United States, it was one of the first areas for heightened sectoral privacy. Again, in the United States, it has some of the highest penalties for the failure to protect that data. But the reasons that people are concerned about the protection of healthcare goes far beyond the embarrassment factor. Um, Obviously, there's a concern if healthcare information is misused by employers to create adverse employment decisions based on one's healthcare experience. For companies that may want to get rid of people in their workforce because they're expensive to insure, or because they have a disease or some kind of affect that results in them not wanting to be included in the workforce. So we have that problem. On top of both of those, we have the issue that healthcare misinformation or disinformation, healthcare data can be used by uh, bad actors, by criminals to resell that information and commit healthcare fraud. And healthcare fraud, individual incidents can mount to tens of thousands of dollars per incident because people who are using false credentials can go in, get different kinds of treatments. It leads to misuse of drug prescriptions, but it also leads to people going in and getting unauthorized surgeries and care and creating that on the record of innocent third parties. So there's just a host of different kinds of healthcare consequences that occur in the healthcare sector that are really unique from other sectors.
Yep, that explains a lot, and it can be of huge concerns, right, when it comes to unauthorized use of drugs and other prescriptions. But healthcare, as we see, right, is often divided into two broad categories, that of individual care and that of public health, right? And then how do you differ, and what are the different cybersecurity risks to each one of these fields? Can you explain a little on that?
Sure. So when we're talking about the two different categories, looking at the area of personal health information, that quite frankly is what most of the regulation is focused on. It's focused on an individual's health record, how that individual health record is stored, how it is processed, how it's used for payment, for treatment, and for various healthcare operations. And the cybersecurity system, while it is being overwhelmed by the data breaches and the data theft, we at least understand that regulatory model. There's an entirely second side of healthcare on the public health side. And this is when we think about the vaccinations that occurred in the COVID system. There's a report out today in the United States on changes to diabetes procedures, environmental health hazards, and we're seeing climate change dramatically impact health considerations for the air quality and the like. This is all the public health side. And there's also an attack going on in the public health side, the politicization of antibiotics, the politicization of the drugs to fight COVID. But we're also seeing tremendous amounts of intentional disinformation. But we've always had crack medicines. We've always had shills who are trying to sell disinformation to monetize public health. But with the explosion of healthcare apps and unregulated information into the healthcare marketplace, we're seeing a tremendous growth in the intentional disinformation of public health and the use of that disinformation to collect money from the public in those regards. So it's a second wave or a second aspect of the problem that really isn't being addressed by governments.
Yep, understood. I think there is a lot of misinformation through these apps and the unregulated usage of this information. But you touched also upon the data theft aspect of things, right? So is data theft the primary concern, or are there like other concerns that drive your study of the healthcare industry?
It's for me what drew me to this area is the intersection between the two topics. So the health data and the personal health information that can be scraped from public websites and can be stolen through cybersecurity breaches or lax practices is used to inform and target the people who are the subjects of the disinformation. And it creates an entire cycle of healthcare misuse so that the people who are the most vulnerable, for typically the people who are the least economically advantaged in the community, are the people who are targeted the most for the disinformation. Their data is the most easily accessible. And so there's this cycle that really creates a disparate health outcome for low-income communities because of the intersection of these two pieces.
Yep. You talked of the intersection of these two pieces, right? So why do different aspects of the healthcare industry have different legal protections, right, in the United States? And is this the same issue as problematic outside the United States, or is this only a regional issue within the United States of America?
Well, certainly the sectoral privacy structure of United States data has led to that separation of healthcare information from other kinds of information. But because the United States prioritizes healthcare information, it shouldn't be a problem for the US. And we see something very similar because even though the GDPR in Europe is a much broader general law, and the same thing is true in Canada and most countries, there is still heightened protection for healthcare data. The problem is, particularly in the United States, we identify healthcare data as information that is going to or coming from a governed healthcare entity. Vast amounts of healthcare information are published by consumers, by patients on social media. People want to be in community groups. They want the social support, particularly for those individuals who have systemic healthcare issues. Being part of health care communities is extremely helpful from a mental health and from an access to healthcare standpoint. It's also critical in the public health sector. But none of that constitutes private health information because it's not a healthcare record generated by your doctor or hospital. And as a result, it is subject to the lesser regime of healthcare protection. And particularly in the United States, which has such a high protection under the HIPAA regulations and relatively modest protections everywhere else, that dichotomy is very stark. And as a result, the vast majority of health information that is created is outside the healthcare protection regime entirely.
Got it. That explains a lot. And that's very unique insight for our viewers as well. But we've also seen the United States Federal Trade Commission, the FTC, recently released a paper on dark patterns, right? So, what are these dark patterns and how does that inform healthcare data protection?
The dark patterns report from the FTC, I think, is going to become a very important part of not just healthcare data protection, but data protection more generally. This is a report that the FTC has been working on for quite a period of time. They did a number of public hearings. And what dark patterns are, as identified by the FTC, are those kinds of practices that that we're all familiar with that make it extremely easy to sign up for a website, to give our information away, and extremely difficult when we want to control what happens, when we want to cancel a subscription, when we want to change our behavior. But it goes beyond that because it also looks at a lot of behavioral economics and what are referred to in the behavioral economics literature as nudges, small things that you can do that don't take away actual choice from the individual, but nonetheless make it much easier to move in one direction than another. And the companies in the healthcare industry and allied industries work very hard to identify behavioral nudges to get people to take actions that most of which have adverse health consequences. And so when you look at the dark patterns in the implication of public health, you see a massive campaign from various industries to exploit the individual at the cost of public health.
Yeah, that explains a lot. And interesting that you touched upon nudges here, right? So, what is this broader relationship between behavioral economics and cybersecurity, right? For example, we've seen the adoption of two-factor authentication is much lower if you compare it to the cybersecurity standards we have here in place. So, how can these nudges and behavior economics be used to drive greater adoption, so to say?
Well, interestingly, the people who understand behavioral economics um, better than anyone are the cybersecurity thieves, right? They have mastered the art of manipulating the public through phishing attacks and other attacks, right? So if you think about it from an exploitation standpoint, there are a host of decisions that are made that are based on behavioral economics, right? There are certain trigger words that consumers tend to respond to. So we get a phishing email, and the phishing email, one of the most popular ones years ago, was a fake email that the attachment, which controlled the malware packet, said payroll data. Right? Everybody wants to know what everybody else is paid at work. They know they shouldn't open that email. They know it wasn't intended for them. But because it is secret information that everybody wants, high rates of click-through, high rates of malware penetration. We've seen recently a switch from inducement to defense in the kind of phishing exploits that people will tend to click on. So instead of saying, you know, you've been given $1 million from your Nigerian uncle, instead the exploit today is you are being billed for this additional service. Thank you for renewing. And of course, you didn't sign up for this subscription. You're very upset that you got this email. So before you think, is this legitimate, you click on it to object to being charged. And of course, it's a false phishing exploit. You've now launched malware into your system. So those are just a couple examples of nudges, but there's many, many more, right? So we have tremendous structural biases and implicit biases in the way that we think about the world. So, you know, one is confirmation bias. And so we get targeted using psychographic information to identify those things that we agree with. So the information tracks us using social media techniques. We identify the things that we believe in, And now we get things that confirm what we already believe. So if we're a little distrustful of the government, the disinformation about healthcare is going to double down on that. If we are people who are strongly influenced by data and very analytical, we're going to get a report that purports to have hard data information for us. And those will trigger our responses much more actively than if we get a message that isn't targeted to us as individuals. And through these kind of behavioral techniques, we move very quickly or much more actively to undertake the things that we shouldn't.
Understood. That explains how these behavior patterns can work. And all of us have been through the phase where we've received emails through our Nigerian prince offering us $1 million for that matter. But do you think that people are late in realizing the importance of cybersecurity in today's setup? And we've still been seeing phishing attacks covering us over the years and people getting affected. So what is your take on, are we too late to realize the importance of cybersecurity setups?
So, it's one thing to say cybersecurity is important, um, and to have this generic statement. And of course, the public believes that data shouldn't be stolen.
Yeah.
But to turn that into positive behavior nudges, we're actually doing a very poor job, right? So there are a host of training programs. We go through these annual training exercises. They're very short. They're not really targeted to the kind of behavioral expectations that we have. Um, and so we've seen many ways that the cybersecurity can be overcome. So one is companies say, yes, the government says we need to have multi-factor authentication, but then as soon as we turn on multi-factor authentication, the company says, oh, do you want to disable it on your particular device? Right? So it sends a very strong message. Yeah, you should have this, but we don't really mean it. Right? And so it sends a signal that we're not really sincere about it.
Yep.
A second is that by not using an authenticator app, just by using text, people will, if they get 5 or 6 texts in a row, click yes just to stop the text from coming in. And so multi-factor authentication can actually be overcome relatively easy. Now, it should be that the software has, that the software has a trigger, just like it used to be that if you try a password more than 3 times, it locks out. That if you receive the same text saying authenticate more than 3 times, it blocks that link. But we don't have those kind of next step protections for consumer behavior. And as a result, even multi-factor authentication hasn't really gone far enough. So again, we're paying lip service to the need for these changes, or we're not really getting to the heart of the kind of cybersecurity efforts that we need to actually protect systems.
Yep, definitely agree on that. I think MFA was a good step, but I think, yeah, we just did lip service to it and it didn't got its outcome achieved in the end, right, of securing accounts and uh, online identities for that matter. But are there any other points of vulnerability, right, beyond websites and apps that healthcare industry in particular needs to consider when dealing with cybersecurity?
So again, I really start with the importance of the disinformation side and the misinformation side. While we're going to continue, there's no doubt that we're going to continue on the cybersecurity protection unless we start paying attention to the disinformation and to the public harms that are going on. We're not going to flip the narrative about healthcare outcomes. And so we really need to invest extremely heavily in training the health sector to create better healthcare information. And when I say better, it's not necessarily more accurate, but the same behavioral economics, the same nudges that are currently being used by the bad actors, right? Governments put out the most generic, unreadable information that they can. So when they put out a healthcare directive, it isn't shared with a network of healthcare providers that can magnify it. It isn't developed into social networks the way that misinformation is. And so much more can be done to get public health entities, hospitals, universities, and governments to create health information that is helpful and positive to better identify sources of accurate and verified information so that the public knows where to turn for verification, that disinformation is snoped, and so it is quickly identified as false, and there's easy to turn to places to identify what's going on around that is misinformation at the time. So there's a host of things that we could do to improve the protection that we haven't done yet.
Yep, I think information is one thing we definitely have to get better at, and making it available to the masses so everyone understand how things are going on. But in general, with public health, right, we often deal with undeserved populations, even in countries like where they have very strong healthcare systems. How does trust factor into the delivery of positive health outcomes, right? And how can cybersecurity, for that matter, and cybersecurity systems can be part of that trust building process?
So trust is essential in the healthcare sector because if you don't trust the information, then you're not going to respond to the information, right? So in many communities, both poorer populations and more affluent populations, we have a huge network of trust in our educational institutions, in our religious institutions, in our communities and NGOs, and they need to be brought into the public health discussion, right? So if you think about the NGO community, religious community, educational community as partners in the public health growth, to say, look, let's take something that nobody thinks diabetes is a good thing, right? Everybody believes we need to change the outcomes. That's a combination of uh, medicine and lifestyle choices. We need to look at that and say, okay, right, in our community, this is what you can do as a community, right? If one of the issues in diabetes is healthy food, now we can come together and say, okay, how do we improve food access in our community and bring those pieces together and look at that as part of the public health initiative. But if we don't have that conversation, if there's not information at the ground that says this is a communal issue that we can invest in and support, then we can't achieve those goals. So it all starts with a network of trusted communication partners and building those communication channels so that when information comes out and is updated, it's sent to our trusted partners, and our trusted partners then reinterpret and redistribute that information.
Yep, I definitely agree on that. I think trusted communities and these volunteers communities will have a huge role to play in building trust, for that matter.